Today I will be presenting about diabetes and helping you understand it a little bit better. We will go through 4 sections in this PowerPoint: understanding diabetes, which we will go through the definitions, facts, symptoms, preventions, and statistics. Then we will be talking about how to treat diabetes and talk about the different treatments and how to test for it. Then we will talk about the researching about diabetes, what research advances have been made towards and the prevention of diabetes. And then last, we will go through our references, which will include online articles, websites, book resources, and things to make this presentation. So first, we will be talking about understanding diabetes. What exactly is diabetes? Diabetes is a disease where the body cannot respond to insulin and is unable to regulate the glucose in the blood and urine. The full name of diabetes is diabetes mellitus. There are 2 types of diabetes: type 1 diabetes and type 2. Type 1 diabetes is an autoimmune disease. It affects the immune system, and it's where it doesn't recognize the insulin-producing cells. Type 2 diabetes is a chronic disease. It is way more common than type 1 diabetes, and it is where insulin is produced, but it is also rejected. This causes blood glucose levels to reach abnormal levels. Next, we have gestational diabetes. Now, this type of diabetes is only during pregnancy. It usually starts midway through pregnancy and stops once the baby is born. It may result in miscarriages, premature delivery, or stillbirth. Women who have gestational diabetes are more likely to have type 2 diabetes in the future. Gestational diabetes itself will go away, but it does increase your chances for type 2. Now we're just going to go through some quick facts about diabetes. How many, how harmful, and statistics. There are over 34.2 million people who have diabetes, and 88 million people are pre-diabetic in the United States. How harmful is diabetes? Diabetes damages major blood vessels to the brain, the heart, and legs. It is harmful to kidneys, eyes, nerves, and feet. Diabetes is the 7th leading causing death in the United States. Though over 30 million people have diabetes, 25% do not know that they have it. 90% of people who have diabetes have type 2. So type 2 is way more common than type 1. There are many symptoms of diabetes. We will be talking about both 1 and 2 types of diabetes symptoms. That would be frequent urination, increased thirst, hunger, dry mouth and skin, unexplained weight loss, blurred vision, and fatigue. Though there are symptoms of diabetes, there aren't always signs, especially if you're pre-diabetic. And that's why most people don't know that they're pre-diabetic, because they're not getting these signs. There are the 3 P's of diabetes, and these are the main symptoms. There is polyuria, which is frequent urination, polydipsia, which is frequent thirst, and polyphagia, which is increased appetite. Can we prevent diabetes? Type 1 diabetes is non-preventable. There is no way to reduce your chance of this disease, but you can reduce the risk of type 2 diabetes. And you can do this by losing excess fat, exercising frequently, and choosing to stick to a diet that doesn't include a lot of processed foods. So type 1 diabetes, non-preventable. Type 2, definitely preventable. Treating diabetes. How do we treat diabetes? With type 1 diabetes, there is an insulin pump, an inhaler, or an insulin by injection. Scientists are working on an artificial pancreas as well. Type 2 diabetes, you can treat it by exercising and losing weight, and that can sometimes control it, but not always. It can make it better for you, make you a little bit healthier, but that does not mean that it will specifically cure it, because, you may need a certain diet accompanied by medicine that will reduce the cell's insulin resistance. You can also classify diabetes by using the A1C test, which shows how well the body has managed its blood glucose level in the last 90 days. So in this chart, we have the diagnosis and the level of the A1C level. So if your A1C level is under 5.7%, you do not have diabetes. If your level of A1C is in between 5.7% and 6.4%, you could be pre-diabetic. And if it is 6.5% or up, you could have diabetes. Now we are going to talk about researching diabetes. A lot of people have goals to researching diabetes, curing it, and just making it better for the individuals who have it. So first, let's talk about the CDC. The CDC is trying to identify more individuals with prediabetes to prevent more type 2 diabetes cases. There is also a National Diabetes Prevention Program website that helps people at risk for type 2 diabetes adjust their lifestyle. Also, the first public service announcement, or PSA, was launched in 2016 to urge individuals to see if they are pre-diabetic. You can take an online test at doihaveprediabetes.org to see if you have prediabetes and steps on what to do about it. The CDC is also working to provide diabetes self-management education and support, or DSMES, to reduce the cost of care. You can join an online lifestyle program for diabetes if you are pre-diabetic and help possibly delay the prevention of, or you can possibly delay or even prevent type 2 diabetes. So just knowing about all these things, whether if you're pre-diabetic or not, can help yourself get yourself diagnosed, or help if you do know that you are pre-diabetic or diabetic. Just kind of learn about it on these websites and make your life a little bit more convenient if you do suffer from diabetes. Here's some more research on how to prevent diabetes. The Diabetes Research Institution Foundation is actively researching and looking for a biological cure towards diabetes. They state that in order to completely treat diabetes, they would need to restore natural insulin production and normalize blood sugar levels without imposing other risks. Their progress is just within reach, but they do ask individuals to support their research by making a donation. Part 2 of researching to prevent diabetes. The American Diabetes Association is progressing in ways to prevent diabetes through these research advances. They are understanding the body weight regulation in children. They are improving continuous glucose monitoring with a novel molecule. They're finding new ways to keep immune cells from attacking insulin-producing beta cells, and they're trying to improve insulin sensitivity. We are advancing in treatments. Not only are researchers, organizations, and scientists trying to research, prevent, and eradicate diabetes, but they are also advancing in treatments for individuals who still suffer from diabetes. So even though we want to find a cure for the people who have not yet got diabetes or may get it in the future, it's still good to treat the people who are suffering from it every day and make their lives a little bit more comfortable or knowledgeable. For example, Health Day, a new artificial pancreas system, helps manage blood sugar, protect the heart and kidney, and delays type 1 diabetes. There is a new immunotherapy treatment which is currently being tested in the third trial in people with type 1 diabetes. There is also another recent artificial pancreas study approached by the FDA called iLet by Beta Bionics. Most of these advances happened just recently in 2019, and there are further expectations in financial assistance, such as more insurance providers and Medicare to help cover the expenses of the treatment and care. So a lot of these advancements are very recent, as I just said, and I think that's really good that we are still advancing. You can research for yourself, and you can aid the research of diabetes by watching out for yourself. Maintaining a healthy lifestyle and watching for diabetes symptoms can help you in the long run, and maybe you know a friend who has diabetes or pre-diabetic, you can help them too. So taking this 1-minute test can help you see if you could be at risk for diabetes. And I have taken the test for myself, and I got a 1 out of 10. So there's only 10 questions. It is really a 1-minute test, and I wouldn't use this to diagnose yourself. I would just use this to maybe see if you should go and get that checked out, maybe get an A1C test. But I really like this test because it's really simple, something you can do for yourself. The earlier an individual finds out if they are pre-diabetic, the greater chance it will be to prevent or delay type 2 diabetes. The more people who are educated on having diabetes, the more treatments and research can be done to help eradicate this disease. So, like I said earlier, 25% of people do not know that they are pre-diabetic. I feel like if we educate ourselves more, educate our friends, maybe send this test around, get them thinking about it, then in the future, more people will know about diabetes themselves, wondering if they have it. And I just think that will help everyone understand it better and hopefully research more and get rid of this disease. Lastly, we have the references made to make this PowerPoint, and I have a few online articles, and I also used my nutrition book to research a lot about diabetes for my nutrition class. I really appreciate you watching my slide and PowerPoint. I hope you learned something. Take that test and let me know what you get, and let me know how you like this PowerPoint. Thank you so much.